Gibson Kohli coming to you with Snackable Health. Well, this is Ovarian Cancer Awareness Month. Talk to me a little bit about the campaigns that are out there to heighten awareness of this disease.
Mike, the unfortunate thing about ovarian cancer is that it's always usually diagnosed very late. In fact, 3 out of 4 women are diagnosed when the ovarian cancer has already spread beyond the ovaries. So, the idea of this month and this campaign is really to empower women, empower men to understand what the signs and symptoms of ovarian cancer may be so that early detection can occur, at which point it can be cured if it's confined to the ovaries. So this month is really about talking about who gets ovarian cancer, how we look for it, and really, what signs and symptoms people should watch out for.
And what are some of those signs and symptoms?
So very non-specific, as you can imagine, a woman's pelvis is really designed, to hold a baby. So you could have an enlarging tumor inside your pelvis and not really realize it until it starts pushing on other organs. So you really want to start to look for any signs that it's changing, your curvature of your abdomen is changing, you're having any change in your bowel habits, you're having bloating, you're having early satiety, not feeling as hungry because it's pushing on your intestines or pushing on, other parts of your bowel. You're having urinary urgency, urinary frequency because it's pushing on your bladder. You've had abnormal changes in your weight, you've had changes in your appetite, anything like I said, or changes in your menstrual cycle that would suggest that it's growing, that there's something that could potentially be a mass in there.
And what are some of the risk factors? And do we know anything about the genetics of it? Does it run in families?
It can run in families. There's some percentage, about 10% of ovarian cancers that are genetically related. The most common one that most of us have heard of is BRCA1 and BRCA2, which is that breast and ovarian cancer relationship. But we also see that certain ethnic groups are higher risk, like Ashkenazi Jews, for example, have a higher lifetime risk of developing ovarian cancer. So we know that there's a genetic component to it. We also know there's some lifestyle components that can contribute to ovarian cancer and risk factors. So, for example, if your ovaries have never really shut off, the ovulation has kind of kept going because you've never had a baby or never been pregnant, that could be a risk factor for developing ovarian cancer as well. And the opposite is also true, Mike. So if you've, been on birth control for more than 5 years, which turns off ovulation, or if you've been pregnant, or if you've been breastfeeding, which also suppresses ovulation, all of those can kind of protect the ovaries, the epithelium or the outside lining of the ovaries from kind of breaking open when you ovulate and protecting you against ovarian cancer.
Are there any resources out there, any websites where women can learn more about this?
Yes. So, the American Cancer Society has a number of resources that, women and men can go to if they either have a loved one struggling with ovarian cancer or just want to learn more about it. If you have a strong family history, it's never too early to talk to your doctor about what type of screening you should get. So, in general, for ovarian cancer, we don't recommend screening every single person because you're more likely to get a false positive, a fake out, than you are to get a true positive, because ovaries, they make cysts, they ovulate, they do things all the time. So we don't screen everybody with ultrasound or with blood markers like a CA125. But if you're high risk, or you have a number of risk factors, I would talk to your doctor because in certain high risk groups, there can be benefit to checking this marker of cancer called CA125 that comes from the ovaries, or to doing an ultrasound, a transvaginal ultrasound, to take a look at those ovaries themselves.
Great. Well, thanks, Paul, for the update. And thanks for joining us here at Snackable Health.